So someone wanted to know about the applications of the Bell's phenomenon in neuro-ophthalmology. And interestingly, this is the same Bell, Charles Bell, for Bell's palsy. So like a seventh nerve thing. And what it is if you have forced eyelid closure, your eyeball will go up underneath the forced eyelid. So when you have people closing their eyes forcefully, their eyeball will be going up underneath the closed lid, even though you can't see it. This is called the Bell's phenomenon. And presumably the reason is if something is coming at you like an arrow, you're going to tilt your head away, you're going to force eyelid closure, and your eye will go up. And so if the arrow hits you, it'll hit the bottom of your eye instead of hitting in the middle of your cornea. So this is the presumptive rationale for having this Bell's phenomenon. It is a reflex between your lid, so it is a palpibro and oculo reflex, and it's an oculogyric reflex. So it is involuntary closure of the lid leading to eye moving upward. Palpibro oculogyric reflex. And the way we use it in neuro-op is because we can force the eye to go up, it'll prove that the infranuclear pathway is intact. So if you have a paralysis of the nerve, like the third nerve, and you can't look up, but you have a Bell's phenomenon, that actually suggests that the muscle and the nerve and the junction can fire because how'd the eye go up? The problem with the Bell's phenomenon is it's not 100%. And even if you have a partial third, you can overcome the weakness with this Bell's phenomenon. However, if it's a complete third and you can overcome it with the Bell's phenomenon, this suggests that the problem with the upgaze is supranuclear. So we use the Bell's phenomenon to prove that the eye can move. And that would suggest that the problem is a supranuclear rather than a nuclear or infranuclear problem. And it's helpful in patients who have the Bell's palsy to have the Bell's phenomenon because it protects their cornea. If they can go up under the lid because they don't have good closure, so you force the eye up under the lid. And so a Bell's phenomenon is a good thing to have if you have a Bell's palsy because it protects your cornea. And that is how Charles Bell found the phenomenon to begin with.